Hi, this is Dr. Hartman. I want to talk for a few minutes about the what herd immunity is by teaching you what herd immunity is not. This is a story I learned from Dr. Paul Offit. You may be seeing who's talking to a lot of people about the COVID vaccines. He is a vaccinologist and a pediatrician, and he has himself invented a vaccine for rotavirus. So the story goes like this. There was this play group of 4 or 5 boys, and this was back in the 1990s, who played together. And it was around the time that the Hib vaccine, which is the Haemophilus influenza type B, which would devastate kids with severe pneumonias or meningitis and devastate them neurologically years ago. I saw it because I was there before the vaccine actually went out that much. And parents were skeptical about it. So these kids played together, and one boy was vaccinated out of the 6. The other 5 boys were not vaccinated. Well, what ended up happening is that this boy had an unrecognized immunologic disorder, who then, within his play group, the kids carried the Haemophilus influenza type B bacteria in their nose, and this boy was exposed to them. And despite the fact he was vaccinated against HBIG, HBIG, I'll call it, he ended up getting meningitis, Haemophilus influenza type B. Tragically, then that's when they discovered he had an immune problem. Sadly, if all his other friends had been vaccinated, he would have been protected. So the point of herd immunity is to vaccinate everybody, because there's assumption there'll be a small number of non-responders or vulnerable people at risk, as with COVID, and that if all of us vaccinate, we will protect those who, despite being vaccinated, are going to have are going to get the disease anyway. So please, please, please think about this. Think about, to learn what herd immunity is, learn what herd immunity is not. Thank you, and have a nice day.